Xi'an lockdown brings the heartbreak and dysfunction as political pressure to contain outbreak growth. CNN. As the lockdown, Chinese city of Xi'an claimed victory this week in its fight to contain the community spread of COVID-19. Harrowing tales of loss and despair have emerged on social media, highlighting the immense human cost of China's zero COVID policy. The city of 13 million has been under strict lockdown since December 23 as it grapples with the country's worst coronavirus outbreak since Wuhan, the original epicenter of the pandemic. But local authorities have faced a public outcry over perceived incompetence and disproportionately harsh measures that critics say harm the lives of those they are supposed to protect. Over the past 2 weeks, Chinese social media has been flooded with posts from residents who say they have not received food, basic supplies, even medical care, painting an image of local government dysfunction as pressure builds on local officials to contain COVID just weeks before major Lunar New Year festivities and the Beijing Winter Olympics. One heavily pregnant woman was allegedly turned away from the hospital on New Year's Day because she didn't have a valid COVID 19 test, according to a post from a user who said she was the woman's niece. A video posted on January 3rd shows the woman sitting outside with a pool of blood around her feet. She was finally admitted 2 hours later but suffered a miscarriage, said the post shared widely on Chinese microblogging platform Weibo before it was deleted. A staff member from Xi'an Kaohsiung Hospital, where the woman sought care, told CNN they were investigating the incident and that the hospital had initially turned away the woman in accordance with the government's COVID 19 regulations, but declined to comment further. On Xiaohongshu, China's Instagram-like platform, a user appealed for help on Sunday after a local hospital refused to admit her father, who had just had a heart attack because they live in the medium risk area of the city. She later updated the post, saying her father was allowed the emergency operation when his situation worsened significantly after several hours. The delay was too long and the rescue failed. I don't have a father anymore, she wrote. The woman posted her encounter in more detail on Weibo on Wednesday night. Her emotional account immediately went viral, affecting 630,000 likes and was shared more than 110,000 times as of Thursday. Workers disinfect vegetables at a residential area under quarantine in Xi'an, China on December 25, 2021. Another video posted online showed the woman in a quarantine hotel on New Year's Day begging a COVID control workers for sanitary pads. In the post, viewed tens of millions of times before it was removed. The woman said she had tried to call multiple government departments to ask for menstrual product, to no avail. The woman later posted that she had received supplies from quarantine workers and said she regretted filming the original video. CNN cannot independently verify the authenticity of these videos and posts and has reached out to the authors for comment as well as the Xi'an municipal government. The poignant account have sparked an outpouring of sympathy and anger online, with many questioning sacrifice in the name of epidemic control. No one cares what you die of, other than COVID-19, on Weibo user posted. Following the public outcry, Xi'an officials told the news conference Wednesday that hospitals must not use the excuse of epidemic prevention and control to avoid treating patients, including critical patients like a pregnant woman. On Thursday, Xi'an authorities said the manager of Xi'an Gaoxin Hospital has been suspended. Staff involved in the incident had been removed from their post and ordered the hospital to apologize to the public. The ruling Communist Party's disciplinary watchdog in the city also issued the internal warning to the head of the Xi'an Health Commission as well as to other public health officials. But these actions have failed to quell outrage on Weibo. The top-rated comment under a state media post about the punishment said, "This just goes to show COVID-19 might not kill you, but bureaucrat can." Residents call to get tested for COVID-19 in Xi'an, China on December 29, 2021. Limit of zero COVID. For most of the pandemic, China has managed to keep its caseload low with its zero COVID approach, meaning no local transmissions, even as the rest of the world embraces living with the virus. There have been occasional outbreaks, but officials have largely managed to contain them within a few weeks by following a playbook of mass testing, partial or full lockdowns, contact tracing, and quarantine. On Monday, the city of Weichu in Henan province, home to around 1.2 million residents, was also placed under lockdown after it reported 3 asymptomatic cases. This stringent approach remains widely popular among the Chinese public, which is used to a zero-COVID environment, said Yang Huang, senior fellow for global health at the Council on Foreign Relations. So many people have not been exposed to the virus, and given that the inactivated vaccine are not that effective in preventing new infections, zero COVID becomes a self-justifiable strategy. A resident received a nucleic acid test in Xi'an, China on January 4th. In a statement on Monday, the Xi'an government acknowledged some problems in providing residents daily supplies, but said it was improving the situation. Community transmission in the city has been brought under control, and the rapid spread of the virus has been contained, said the state-run news agency Xinhua in the article on Wednesday, citing local authorities. The city confirmed 63 new locally transmitted cases on Wednesday, bringing the total caseload to 1,856 since December 9th. Cases had hovered near or above 100 in previous days, before a significant drop to 35 on Tuesday. But many Xi'an residents have pushed back on officials' claims. Though the government has distributed food to some throughout the lockdown, others say they haven't received their supplies or have only been given food a handful of times throughout the 2 weeks. Others pointed out that rates of community transmission may be distorted, with more than 42 1,000 residents taken to the government quarantine facilities. Videos of the quarantine sites showing Spartan rooms with metal bunk bed and no mattresses have sparked further criticism online. Zero community COVID is such a clever word as we just need to keep transporting patient and close contact out until Xi'an's cases are zero, on Weibo user posted. If there are no people in the neighborhood, of course there is no community transmission there, another user wrote. Rising pressure. These measures and the chaos unfolding for those stuck at home bring into focus the burden borne by citizens for China's COVID strategy, its questionable sustainability and increasing political pressure on local officials to bring outbreaks under control. Officials who struggle to contain COVID flare-ups often face suspensions or dismissal. Last summer, more than 40 local officials across the country were punished for failing to control the Delta outbreak that spread to more than half of China's provinces. This week, the party secretary of Yanta district in Xi'an, one of the worst hit areas, was also dismissed. This pressure had been in place for much of the pandemic, with the ruling Communist Party often hailing the success of its zero COVID strategy as an ideological and moral victory in comparison to Western countries that struggle to control their own outbreaks. But that pressure is now intensifying as February approaches, bringing with it the Winter Olympics, a major point of national pride and rural New Year, the country's biggest annual holiday, when hundreds of millions of people typically travel domestically. With these two events looming, Xi'an officials were asked to achieve zero community transmissions by January 4th, said Huang. That's the kinds of pressure that these local officials were facing, Huang added, referencing the dismissal of Yanta's party secretary. The chaos in Xi'an also reflects the differences in local governance capacity, he added. Shanghai, for instance, was the highly efficient and competent bureaucracy that allows the officials to detect outbreaks early, conduct contact tracing quickly, and avoid the kinds of citywide lockdowns seen in Yuzhou and Xi'an. In contrast, those two cities both have a relatively low local state capacity to come up with a well-prepared plan for outbreak preparation to deliver necessity to people in quarantine and under lockdown, Huang said. When the capacity is low, government officials were more likely to turn to heavy-handed, indiscriminate, and even excessive measures that significantly raise the cost of implementing this zero COVID strategy. The strategy has worked relatively well thus far in shielding most of the China from the virus, but its limitations are also becoming increasingly clear. China is not epidemiologically or psychologically ready for the Omicron variant, Huang said. The problem is we don't know whether zero COVID can still be effective in dealing with the more transmissional variant, and if outbreaks with transmissionable variant spread to multiple cities across the country, you are going to see the cost, therefore the dissatisfaction, he added. The unhappiness is going the unhappiness is going to grow significantly at the national level as well as the difficulty of implementing this strategy. CNN's Lily Lee contributed reporting.